In the quaint mill town of Hyde, England, Irene Turner had come down with a cold. Irene's husband died a few years earlier, and now she lives alone. A neighbor, Michael Woodruff, periodically checks in on her.
She hadn't been feeling very well, so she phoned for the doctor to visit her, and he said he would visit later on that day.
Irene disliked doctor's offices, so Dr. Shipman usually came to her. One of his fellow doctors, Jeremy Dirks of Brooks Surgery, knew of Dr. Shipman's strong bedside manner with his patients.
Dr. Shipman was very much the old school type. He liked to deal with the patients from the cradle to the grave, patients who maybe with another doctor may have been admitted to hospital, he would care for at home. If somebody rang with a chest pain, nowadays we will call 999 and get an ambulance, get a paramedic crew. He would go out to see them.
Dr. Shipman decides to send her to the hospital and tells her to lie down until the ambulance arrives. Since Michael Woodruff is out for lunch, the doctor asks another neighbor if she will wait with Irene. Dr. Shipman can't stay, as another patient needs his immediate attention. Shipman looks in on his patient one more time before leaving. When the neighbor arrives, she finds Irene lying on the bed, and it looks like she isn't breathing. She won't wake up. Her neighbor immediately calls Dr. Shipman, then tries to find Michael Woodruff. Dr. Shipman rushes back to Irene's home, and the neighbor finally locates Michael Woodruff.
I got a phone call from a lady that lived opposite to Irene and said, "Mike, I'm at Irene's with Dr. Shipman. He thinks she's dead." I immediately came down. The neighbour was still there, and so was Shipman.
Dr. Shipman's initial diagnosis is heart failure, brought on by advanced diabetes. But Irene Turner's family was not aware she had heart problems.
It shocked me to the core. 1 minute, she was in bed. I'd brought her some pastry for her dinner, and she was fine. And in the next minute, she's dead.
It was very sudden and upsetting. Just absolute shock. It wasn't something that was expected because she was so fit. I'd spoken to her the day before.
It seemed as if Irene simply had the common cold. Her death perplexes her family. Was something targeting Dr. Shipman's patients? While the doctors hadn't found any reason to be alarmed, someone else in the town was becoming suspicious. According to Hyde taxi driver John Shaw, something just wasn't right. There had to be an explanation.
There were so many of them. Ladies that I'd had in the car only days before they died.
Anna Spencer and Irene Turner were both regular customers of Shaw, and the news of the deaths came as a shock. The deaths continue as Shaw loses yet another one of his customers from an apparent heart attack.
I'd built up a considerable clientele of ladies in Hyde, and one day I was told not to pick a particular lady up because she'd passed away.
Shaw didn't think these women were the first. Several others had also died unexpectedly.
Although they weren't 100% fit, there were none of them, in my opinion, that were on death's door.
Why were Shaw's clients being targeted? And by what? And possibly by whom?
I couldn't explain to myself why all these ladies had all died in very similar circumstances.
Each death taken alone can be explained. Heart attacks do kill without warning. But Shaw is the only person in town who sees the whole group. Shaw is afraid, but does not know what to do besides keep a list of each strange and suspicious death. In another part of Hyde, Dr. Harold Shipman looks over his case files of yet another unexpected patient death, James Davidson. Dr. Shipman goes to Dr. Jeremy Dirks to review the death and to sign the necessary cremation paperwork.
It was not an unexpected course of events, particularly when I was given a detailed account of the last few days, months of his medical history.
Shipman explains to Dirks that he had seen James earlier that day and that the patient had long-term circulation problems, especially in his legs. James's brother, Frank, waited in the kitchen during the examination. Dr. Shipman said he quickly realized James was in trouble and needed to go to the hospital immediately because he had an irregular heartbeat.
He had a long documented history by Dr. Shipman of heart failure and respiratory problems, and he was the sort of patient who could suddenly develop acute heart failure.
Right. James is taken.
Shipman went to tell James's brother to call an ambulance.
Yes.
But by the time they got back to the living room, James was sitting in his chair, motionless. It had only been a few minutes, but a few minutes too long. James Davidson's heart had stopped.
Most of the causes of the deaths of Dr. Shipman's patients tended to be sudden deaths or fairly